While we remain standing, can we recite the second stanza of the national anthem on the count of two? 1, 2. O God of creation, direct our noble course, guide our leaders right, help our youth the truth to know, in love and honesty to grow, and live in just and truth. Great lofty heights attained, to build a nation where peace and justice reign. Amen. May we please be seated. Distinguished ladies and gentlemen, it's my honor and privilege to welcome you to the swearing-in ceremony of foreign-trained medical and dental graduates by the Medical and Dental Council of Nigeria. If you're here and proud to be seated in this auditorium, awaiting your induction, awaiting your admission, awaiting your verification to practice as a medical or dental professional in Nigeria, please put your hands together for yourselves. And yes, feel free to make some noise, it's allowed. The Medical and Dental Council of Nigeria is determined to safeguard the best healthcare delivery for Nigerians. They're committed to be the foremost professional regulatory body in Nigeria. The role includes determining the standard of knowledge and skill to be attained by persons seeking to become members of the medical and dental profession across the length and breadth of Nigeria. It's on this note that an assessment was conducted for a number of applicants. Among these, you all were found worthy in knowledge and skills to practice medicine and dentistry in Nigeria. The man at the helm of affairs of this council, who is saddled with the responsibility of ensuring that the standards set by this council, established by law as far back as 1963, is maintained, is a man who is well experienced and versed in the practice of the medical profession in Nigeria and beyond. Although he bagged his first degree from Nigeria, he received other degrees and qualifications from across the world, including the Fellowship of the Royal College of Surgeons, both in London and Glasgow. Upon return to Nigeria, he served the country meritoriously in various capacities, both administrative and clinical. He was bestowed with the prestigious Officer of the Order of Niger award by the Federal Government of Nigeria. He has served the country as a Chief Medical Director at one time, and at another time as a Deputy Vice Chancellor. His exploits as the chairman of this council includes the fact that you're able to have this induction in an auditorium proudly owned by the council itself. If you had a smooth drive into the premises of the Medical and Dental Council of Nigeria, you owe him a gratitude for his indefatigable efforts as the chairman of council. He's seated here today. He is a retired professor of surgery, but never tired. And he's happy to welcome you into the profession. Distinguished ladies and gentlemen, he deserves a warm round of applause. The chairman of this occasion, Professor Abba Waziri Hassan, OON. Sitting right next to him is the Honorable Minister of State for Health. If you're familiar with the Nigerian political terrain, his face, he needs no introduction. The face mask has masked one of his signatures, but his signature cap is there for us all to appreciate. He's one who is introduced with dual profession as a medical doctor and a politician. He's one of the recipients of what you can proudly call combined honors. He bagged a bachelor degree in health sciences and capped it with a Bachelor of Medicine, Bachelor of Surgery degree. He has served the country as the Speaker of the Lagos State House of Assembly. He has served the country as a distinguished senator representing Lagos Central Senatorial District. It must have been Lagos East, beg your pardon. He's also served as the Chairman Conference of Speakers. Distinguished ladies and gentlemen, today we have a special guest of honor, the Honorable Minister of State for Health, Honorable Senator Dr. Olorunnibe Mamura. Sitting right next to him is a man who needs no introduction. You all must have come in contact with him at one point or the other, directly or indirectly. He's the one vested with the powers to endorse your license to practice in Nigeria. The reason for which we're all gathered here today. He's a man who is a definition of commitment to excellence, passion, even in the face of daunting challenges. A man who is never to be intimidated as long as he's on the right track. He's responsible for the day-to-day running of the Medical and Dental Council of Nigeria. His efforts since assumption of office to revitalize the council has a number of results to show for it. Distinguished ladies and gentlemen, please put your hands together for the Registrar, Chief Executive and Secretary to the Council of the Medical and Dental Council of Nigeria, Dr. T.A.B. Sanusi. We have here with us distinguished council members who have been supporting the council to ensure that the standards of medical and dental practice in Nigeria remains high. Distinguished ladies and gentlemen, members of the council, with the utmost sign of respect, may I request you to please stand for recognition in unison. Members of the council here present, please. Thank you very much. May I, on the same note, recognize the presence of the team, the management team who have been supporting the registrar in the day-to-day running of the different departments, units, and activities of the council. The members of the senior management team of the Medical and Dental Council of Nigeria, may we please rise in unison for recognition. To join the high table is a man who's here in his capacity as a member of the council, who's been duly recognized as a member of the council, but he's also here as the chief scribe of the Nigerian Medical Association, the Secretary General of the Nigerian Medical Association, and the distinguished consultant obstetrician and gynecologist, Dr. Phillips Ekpe Uche. Ushers, please. Permit me to also introduce to you a man who you may all have seen. You all have seen, actually, but you may not be aware who he is. He's a man who does not have a lot to be introduced with, other than the fact that he is a medical doctor and a broadcaster. Distinguished ladies and gentlemen, the Master of Ceremonies, Dr. Hamid Adediran. You were expecting me to call someone else, right? Next time I'll bring my citation and read before I introduce so that you all will be expecting. On this note, may I request for the opening remarks. Respectfully hand over the microphone to a man who I'm always privileged every time I'm able to give the microphone to him. This is a man who are far apart when it comes to almost every ramifications. If I feel proud of my folio number, I'm sure it trails far behind his folio number as a medical practitioner in Nigeria. If my file in the council is of 10 pages, I'm sure his will be in hundreds of pages. Distinguished ladies and gentlemen, here is a man who I respect so much, and I know that you all respect, as the chairman of the council whose exploit has birthed today's event. Distinguished ladies and gentlemen, please welcome to the microphone the chairman, Medical and Dental Council of Nigeria, who is also the chairman of this occasion, a professor of surgery, a fellow of the Royal College of Surgeons, fellow of the West African College of Surgeons, officer of the Order of the Niger, Professor Abba Waziri Hassan.
Thank you very much. Honorable Minister of State for Health, Dr. Senator Adeleke Mamora, Director, Hospital Services, Ministry of Health, Dr. Abimbe Adebi, NMI, Registrar, Medical and Dental Council, members of council, management staff of Mdcn, parents and guardians of inductees, members of media, inductees, distinguished ladies and gentlemen, I welcome you to this second leg of the special induction ceremony, which is being held for the second time at the premises of Medical and Dental Council of Nigeria in this period of pandemic of COVID-19. We consulted widely with MCT COVID-19 team in order to comply with the protocol. This necessitated the holding of the ceremony in 3 batches. We appreciate all those who facilitated the conduct of the examinations in June 2021 at University College Hospital, Ibadan, and the University of Ibadan. A total of 1,042 candidates appeared for the examination, consisting of 1,019 medical graduates and 33 dental graduates. 862 medical and 17 dental candidates passed the examination, giving an overall success rate of 80% for the medical and 51% for dental. This is the best result in the record of this examination. I congratulate the inductees and their parents, as well as staff of Medical and Dental Council of Nigeria. We appreciate the staff of University College Hospital Ibadan and University of Ibadan for providing the facilities and serene environment for a hitch-free examination. We appreciate the dedication and commitment of the examiners who worked diligently to organize a transparent and reliable examination, often working at extremely unsocial hours. We continue to move the examination to different zones of the country for equity, but it's becoming expensive for both the candidates and the council. We plan to have a structure at the premises of the council. This is a long-term plan and will be expensive for Mdcn to handle without special intervention fund. We plan to go on advocacy visit to the National Assembly to provide special fund to be allocated to execute the project. We will appeal to other organizations like NMPC, CBN, and FRIS to assist as well. I wish to acknowledge the support we continue to receive from our parent ministry in the conduct of this examination. The ministers, the permanent secretary, and the directors have given an unlimited support. On this occasion, we are not presenting any medical elder or guest speaker because of the time constraint in order to comply with the COVID-19 protocol. I wish to welcome the inductees to the noble profession. They should dedicate their time and energy during the period of housemanship, which is the foundation of their professional career, and also abide with the oath they will soon take. The Ministry of Health had approved Federal Executive Council decision to centralize housemanship coordinated by Mdcn. The central housemanship started since January 2021. Candidates who have qualified in medicine and dentistry are to log on the Mdcn website for guidance based on the existing vacancies in all the federal hospitals. Once they report to the hospital, their details are transmitted to Mdcn, which endorses the list for payment by Accountant General of the Federation. There were initial hitches at the beginning of the program between the hospitals and Mdcn. This has since been sorted out, and payment of salaries of house officers is now without any hitches. There are no outstanding payment to any house officer up to the end of July 2021. Council will constitute a monitoring committee consisting of the Nigerian Medical Association, Committee of CMDs, Ministry of Health, and Mdcn to address difficulties related to posting and rejection of house officers by some hospitals. I wish to reassure the Minister, parents, and the inductees that your placement for housemanship will be smooth as long as you do not insist on specific hospitals. I wish to emphasize to CMDs that no candidate should be rejected on posting without referring to Mdcn for discussion. From January to date, Mdcn was able to accredit more than 30 hospitals, increasing their carrying quotas of the institutions for housemanship. This will increase the number of placements available so that no qualified doctor will be on the street, without a place. We appeal to state governments to improve the facilities in at least one hospital per senatorial district. This will increase the number of places for housemanship and reduce the internal brain drain to federal hospitals. Few states have started, specifically Lagos, Katsina, and Ogun. Distinguished ladies and gentlemen, I wish you all a safe journey home. Thank you very much.
I would think the chairman of the council deserves a louder round of applause. Thank you very much. And on that note, I would like to hand over the microphone very quickly because this is going to be in 3 batches. This is the second batch. I'll be moving to the third batch in earnest. May I request to the microphone the Honorable Minister of State for Health in the Federal Republic of Nigeria, the man with so many titles that we only have to cut it short and recognize him by as much as we know or time can permit us. Senator Dr. Olorunimbe Mamora.
Please sit down. Thank you very much, the MC. When you introduced me as representing Lagos Central in the Senate, I was going to quickly correct that, but thankfully you corrected yourself. I was just going to remind you that the wise men came from the east, so I represented the east. Okay? Lagos East. Thank you. Let me first welcome everyone here present to the age of the new normal. When I say the new normal, that is why everybody here present is a masquerade. We're all wearing masks, and you hardly know who is greeting you at a given point in time. I tend to have some difficulty when invited to the podium to speak because of the issues of protocol. But I want to thank Mr. Chairman for bailing me out. Mr. Chairman, who is with us in dual capacity as the chairman of Medical and Dental Council of Nigeria, and also the chairman of this occasion. I do know that, as usual with us in Nigeria, we've been able to solve the problem of protocol by either saying all protocols duly observed, or I stand on the existing protocol. That is the one I avoid. I avoid standing on the protocol so that the protocol does not get suffocated and end up at the intensive care unit. So, rather, I align myself with the protocol established by the chairman of this occasion. I am highly delighted to be in your midst to share the joy of today's great occasion of the induction of our dear foreign-trained medical and dental graduates that passed the Medical and Dental Council of Nigeria examination held in June 2021 at the University College Hospital, Ibadan. And I wish to express my profound congratulations to you all. The stakeholders of today's event not only deserve our commendation, they also merit being congratulated for a job well done. And of course, in this regard, I want to give kudos to the chairman of the council, as well as to the energetic registrar of the council, the man I popularly refer to as Tablet, because the initials are TAB. Mr. Chairman and the registrar, and through you to your team, let me thank you, because today's event in terms of movement to this place is much better than what it was last time. And I can only believe that it will get better and better. Thank you very much. So the stakeholders of today's event not only deserve our commendation, they also merit being congratulated for a job well done. These include the Honorable Minister of Health, who was here earlier today in this three-phase event, the chairman of the Mdcn, our amiable Prof., the registrar and staff of Mdcn, Joint Admission Matriculation Board, management and examiners of UCH and Distinguished Medical and Dental Council of Nigeria, external examiners. I congratulate family members, particularly parents of the graduates, the guardians, friends, and well-wishers who are gathered here today to witness this event. I am confident that given the rigors of the training of these inductees and the added layer of assurance by the Medical and Dental Council of Nigeria, certifying your capabilities, the Nigerian populace stands to benefit immensely from the expertise of these medical and dental graduates. You surely will impact the Nigerian healthcare sector positively by extrapolation of the age-long saying that health is wealth. It will be right to infer that a healthy nation is a wealthy nation. This is what our dear nation stands to gain from the practice of the art of medicine, into which you are being inducted today. The federal government of Nigeria, under our amiable President Muhammadu Buhari, recognizes health promotion as an essential component to achieving the highest level of health and development of individuals, families, households, and communities across Nigeria. Health promotion interventions will adequately resourced and deployed to effectively address the increasing burden of diseases, other public health challenges, and social determinants of health. Hence, the 879 esteemed medical and dental graduates before us will assist in achieving the federal government health promotion policy and contribute their quota to support the healthcare development sector. The federal government is continuously improving housemanship conditions and ensuring that medical and dental graduates are given the necessary orientation and enabling environment for a seamless integration into their job and society at large. Let me assure you that the Medical and Dental Council of Nigeria has been properly positioned for the posting and placement of all house officers. Distinguished ladies and gentlemen, I cannot conclude my remarks at this auspicious event without touching on two issues our dear nation is confronted with at this period. The first is global, the COVID-19 pandemic, and the second is the National Association of Resident Doctors strike action. On COVID-19, in spite of the antics and misinformation of the naysayers and anti-vaxxers who live in denial and churn out misleading information, particularly on the social media, the evidence of COVID-19 devastation on lives and livelihoods of the human race remains undoubtedly glaring. Hence, I call on you all to take personal responsibility for your health. Ensure you get vaccinated, as vaccination offers the greatest chance for survival, even if one gets infected invariably. I also enjoin you to comply with the non-pharmaceutical interventions, like being observed here today, use of face masks, physical distancing, washing of hands, and avoiding crowd as much as possible. The ongoing doctor strike is most unfortunate and most undesirable. I therefore, as usual, appeal to the Nigerian Association of Resident Doctors to end the action forthwith. Go back to the negotiating table and engage government for an amicable resolution of issues in dispute. I'm happy to recognize the presence of the General Secretary of the Nigerian Medical Association, and I'm sure he and the executive of NMA, they have been working so as to end this strike. Thank you for what you're doing. This naturally brings to fore the Hippocratic Oath that will soon be administered on our medical and dental graduates. The basic tenet of this oath is the preservation of human life and the elimination or reduction of pain and suffering of our patients. Our patients deserve no less. Let me remind you, the oath you are taking today is a solemn one, a covenant with God and humanity. You should resist the temptation to withdraw service to your patients under any guise, as it will not only be inimical to your professional ethics, it may also impinge on the integrity of the profession. Distinguished graduates and worthy colleagues, because that's what you are today. It has been a long walk and hard work to bring you thus far. Please accept my hearty congratulations. Welcome on board to our noble profession, and I wish you a future assured. Thank you very much.
Thank you very much, the Honorable Minister of State for Health. I would have been surprised if he didn't talk about being involved in industrial action. And for the past few days, I've had to always explain to people that, yes, I am a young doctor, but I'm not a resident doctor, especially when the bashing comes. You people that have gone on strike again. Interestingly, the Secretary General of the Nigerian Medical Association is here, and I'm sure he would intensify efforts to make this happen. Distinguished ladies and gentlemen, we have with us a number of dignitaries whose wards and children are being inducted into the medical profession today. One of them is a distinguished medical practitioner, a very senior colleague in the profession, a former member of the Medical and Dental Council of Nigeria, Dr. C.U. Ejen. And of course, we have our royal fathers whose children also are being inducted today. First is the Gomo of Kuje, His Royal Highness Alhaji Haruna Tanko Jibrin, MFR. I hope I got the name correctly because I'll soon be approaching you for land somewhere. Thank you, sir. We'll also have with us the Aguma of Gwagwalada, His Royal Highness Alhaji Muhammad Magaji. You're welcome, sir. Congratulations. If your son does not get a place in University of Abuja Teaching Hospital, you know what to do, sir. At this juncture, I'd like to invite to the microphone the man who, at the naming ceremony, there must have been a prophecy that he would one day be in charge of the affairs of medical and dental practice in Nigeria. He was given names whose acronyms represent what we use when we prescribe tablets, TABS. Distinguished ladies and gentlemen, having initially practiced as a medical officer, entrenched in the practice of the profession, leading the medical team at the defunct NITEL, he was engaged by the Medical and Dental Council of Nigeria. He rose through the ranks, gathered all the knowledge and experience and skills, exemplified himself in medical jurisprudence. That qualified him to be appointed as the Chief Executive Officer and Registrar to the Medical and Dental Council of Nigeria. Distinguished ladies and gentlemen, please welcome to the microphone the man who shared something in common with you all, having been examined at the prestigious University College Hospital, Ibadan. The same hospital where I was examined and certified to be a medical practitioner in Nigeria. Distinguished ladies and gentlemen, the louder the applause, the more I will know you appreciate the registrar, Dr. Tajuddin Adisa Bola Sanusi.
The chairman of this occasion, who is no other person than our maybe chairman, Professor Abba Hassan, Waziri Mubi, OON, the Honorable Minister of State for Health, Senator Dr. Right Honorable Adeleke Olorununbe Mamora, the Director of Civil Services, Verizon Ministry of Health, council members present here today, our other medical elders present, the royal fathers in our midst, the proud parents and guardians, the inductees, gentlemen of the press, distinguished ladies and gentlemen. Let me use this occasion to congratulate the inductees on the success of the assessment exam carried out at the UCH. Yes, today's ceremony is supposed to be a solemn ceremony. It's a call to service, and that service is service to humanity. But before I go ahead for the induction proper, I want to seek for the permission of the chairman of this occasion to let me say one or two things about the professional discipline here. By the law of council, the law setting of the council, we have our dictionary organs, the medical and dental practitioners investigating panel, and the medical and dental practitioners dictionary tribunal. The panel is saddled with the responsibility of carrying out preliminary investigation into alleged professional misconduct. I underline alleged, it's an allegation. Nobody's on trial. The panel meets in camera. The panel, they investigate, and if at the end of the investigation, the doctor has no case to answer, the matter ends there. If the doctor has a case to answer, the matter is transmitted to the disciplinary tribunal. In exceptional cases where the doctor is found to constitute danger to public health, that doctor is suspended immediately. However, the trial must be fast-tracked. I have to say this before the inductees and their parents so that they know the enormous responsibilities that are being bestowed on them by being inducted into the professions of medicine and dentistry. In addition to that, if for whatever reason, whether related to the practice or not, if you are found guilty of any criminal offense anywhere in the world and they get to the notice of council, what we need to do is to get the judgment placed before the IP, they look at it, they invite you if need to be. If not, the matter is transmitted to the tribunal. The tribunal can give a directive. At the tribunal level, it's a proper court. Though within the legal palace is an inferior court, where the rule of evidence is relaxed. Trials carried out. At the end of the trial, is either the doctor is discharged and acquitted, or admonished, suspended, or struck off from the relevant register. I can assure you that when it comes to professional discipline, Medical and Dental Council of Nigeria is at the forefront in all the professions in Nigeria. That is why there is nothing hidden about your conduct, my conduct. Don't think I am Nguru, I can do this. Somebody can pick it up and report you to council. Then we take the matter up. Having said that, we are all aware of issues that have been surrounding the housemanship matter. At the beginning of this year, the federal government implemented the earlier decision of the FEC on centralization. Like the chairman said, as at end of July, Mdcn is not owing any house officer 1 naira. If any house officer did not receive salary, I think the problem is from their teaching hospital, because we expect that they be cleared by 15th of every month. At the same time, you are all aware of the ongoing strike by the NARD. It's rather unfortunate. The masses are the victims. But as house officers, and by Mdcn policy, you are not members of ARD. But by the Nigerian Constitution, you can elect to join anybody. You can join them, no problem. But make sure it does not affect your posting as house officers, because these postings have been structured in such a way that you undergo 12 uninterrupted weeks in each of the postings. 12 uninterrupted weeks. At the same time, we are not ready to actually accept any form of resignation. If aspirants spending 1 month, 2 months, or 7 months, and you say you are resigning, you have to return all the money that have been paid to you. The fund is not there. You make up your mind whether you want to go in or you don't want to come in at all. Over the years, people have been suffering, moving around from one place to the other. Now, the ground has been softened. We will not allow anybody to make a mess of that project, because the federal government is very magnanimous in this respect. And that's why in the last few months or the beginning of this year, you cannot hear anybody shouting about placement of this house officer. Nobody post anybody, and don't come here for preferential posting. Log up to our website, get a web portal, pick 3 hospitals. If there are vacancies in any of them, you are lucky. If there are no vacancies, the system will bring up all hospitals throughout the country where there are vacancies for you to pick one. That's why I said there is no room for preferential treatment or posting. You go in on your own. If you pick it, 3 letters will come up. Letter of appointment, 1 to your mailbox, 1 to Mdcn, and 1 to the host hospital. Print your own, you go there, they collaborate, they do documentation for you, you start enjoying the housemanship thing. Your salary comes every month for 12 months, consecutive months. If you get extension, it is pro bono. Nobody pays you more than that 12 months. I repeat, if for whatever reason your house job is extended, the extension is free of charge. Having said that, we are trying to welcome into the profession, and we need to let you know that this is a disciplined profession. Our profession is like a paramilitary. Our seniority is always there, no matter what. We respect our seniors. And that's why when you get into the hospitals, you do what you're supposed to do. And as doctors, you are leaders of the team, but your leadership must be earned. Yes, you meet matrons, lab scientists who have been there for 20, 30 years. They deserve to be respected as well. But do your work as you are supposed to do. Having said this, and with the time far spent, May I request the permission of the elders present here to carry out the induction. The inductees, can you please rise up? You all raise your right hands up. On page 9 of the brochure. Page 9. That's where you have the petition's pledge. Raise your right hands up and say after me. Please, it's a moment that you need to dedicate to this pledge, because you are taking the pledge to say that the health of your patient shall be your first consideration, no matter what. If I say, I, doctor, mention your names, then you still register after me. I, doctor, do sincerely and solemnly declare that as a registered medical or dental practitioner of Nigeria, I shall exercise the several parts of my profession to the best of my knowledge and ability for the good, safety, and welfare of all persons committing themselves to my care and attention, and that I will faithfully obey the rules and regulations of Medical and Dental Council of Nigeria and all other laws that are made for the control of medical and dental professions in Nigeria. I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit the considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity, and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of health care. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I made these promises solemnly, freely, upon my honor. So help me God. You are welcome to the profession. While you keep standing, you have to affirm the pledge. And immediately after, you will be given the forms which you are going to fill, sign, which will be finally signed by me and put in your file. In case there are reports or complaints against any of you, you can't say that you did not affirm to the pledge. So at the same time, you all raise your right hands up. Ordinarily, we ought to have called you one after the other, but for COVID-19 protocols, we have to do it together. We believe, you all believe in one thing or the other. You believe in God either through the Holy Quran or the Holy Bible or other forms of belief. So raise your right hand up and say after me, I, Dr. hereby affirm the pledge I have taken. So help me God. Thank you very much.
Maybe before now, your family, friends, and colleagues have been referring to you as doctors. Maybe you've even had to practice as a doctor in the past. Now is when you earned the title and the qualification of being a medical doctor. And for that, I say congratulations to you all. Please put your hands together for yourselves. Yes, it shall not spoil. You may please be seated. But as you get seated, please be reminded that you have just been inducted into one of the noble professions, the medical profession. You have joined the generation of doctors who have practiced on the soil of Nigeria from the year 1472, when the first set of allopathic doctors landed in Nigeria. There is the need for you to pay honor to whom honor is due. And may I respectfully request Dr. Henry Okukonye to conduct this exercise, where you will pay homage to those that have played significant roles in your admission into the medical and dental profession in Nigeria. Dr. Henry Okukonye, please. The head of registration of the Medical and Dental Council of Nigeria.
Thank you very much. Our most distinguished chairman of this occasion, it's yet again another privilege and I consider it a high honor to conduct this part. Part of the pledge you made today is that you will foster the honor and noble traditions of the profession. So we would like to see you practice that now, beginning from now. I'd like you to rise to your feet. There is a tradition that is known to medicine, and that is the traditional bows, 3 bows. The first one will be to the President, Federal Republic of Nigeria, and he is represented by the Minister of State for Health. We will plead with him to rise to take that bow. Honorable Minister of State, sir. That bow is for policies that was made, enabling the environment to receive you after your training to practice medicine in Nigeria. It is not easy in many climes. Sometimes where you get to where you practice, where you studied, you cannot practice there. But policies are enabling, the ground is softened for you to come back and be received as Nigerians to practice here. Therefore, at the count of 3, I'd like to see you do a good bow. I know you have Yoruba friends, and the Minister of State is a Yoruba man. When they bow, they bow. You have to be on the floor, be on the floor. And until I say stop, and you see him smiling through the mask, don't rise. So at the count of 3, 1, 2, 3, let's go. You are not buying. Remain buying until he's happy that you are buying enough. Are they truly grateful, somebody? You may rise. Thank you very much, sir. You may please be seated, sir. The next bow is for those that ensured that you are properly trained and acceptable to practice medicine in this country. And that is all the examiners, all those that taught you in your various centers, so you have to understand the tropical situations here. And that bow will be taken by the chairman of the occasion, the custodian of ethics in Nigeria, our own chairman of the council, Professor Abba Hazan. Most of you, when you came to the profession, your hands were like hands of mechanics and bricklayers. But you were trained and tutored in the art of palpation. Now you can palpate and feel masses. Before, you wouldn't have been able to do that. When I was in the university myself, I wanted to touch a patient, a child. And one professor from Uniben told me, stop that. You are a crude doctor. Don't try that. So, but now, through the process, you now learn the art and the science of medicine. I'd like you to give a very good bow to this very distinguished chairman of this occasion today. At the count of 3. 1, 2, 3, go. Are they buying enough? Are they still buying? You may rise. Thank you. Now, the final bow is for those that saw you through your training. When your parents saw your letters, their hearts failed. Some of you are used to telling lies. You bought oxygen to breathe. Thank God you have finished school before COVID came. But I've been asking for money to buy vaccine. Some of your parents went from church to church, mosque to mosque, asked for prayers so that you can just finish and come back. So they suffered for you, prayed for you, both spiritually and otherwise. I like you. You are facing the screen, so you are seeing your parents there. You are facing the screen. So bow until they are happy that you are really grateful that they saw you through your academics. Are you ready to do that? 1, 2, 3, let's go. They are not bowing, you are still standing, you are posing. Are they doing it well, parents? Rise, really rise. Congratulations, congratulations.
Thank you very much. There are no more bows. You may please be seated. There is this very important announcement. There is an ATM card that was lost and found. Something tells me it has a lot of money in it. So if it's yours, please approach the protocol and they can retrieve it for you. May I also remind you all that you are to fill your oath forms and sign accordingly for submission. On that note, let me once again join all your friends, family, and well-wishers to welcome you into this profession. And I would like to, we need to round up because the third batch will be coming in shortly. Please exit through the side. I know you entered through here. Please exit through the side so we can have the last batch come in. And I know you would like to take pictures, but please make it very quickly so that the last batch of inductees can have theirs. On that note, let me welcome to the microphone for the vote of thanks the Deputy Registrar, in charge of medical education in the Medical and Dental Council of Nigeria, Dr. Nemeka Wakama. A round of applause for him, please.
Thank you. As we come to the end of the program, let me, by the kind permission of Mr. Chairman, extend a warm gratitude to everyone who has contributed in no small way to making this event a success. Special thanks go to the Honorable Minister of State, an accomplished medical practitioner and administrator whose stint at the red chambers of the National Assembly left a reference mark for legislative activism. We would like to thank your parents who have seen you through your training and have also come here to witness this initiatory rite of passage into the medical world. Not forgetting our very esteemed members of council who, under the leadership of an elder statesman, have continued to provide guidance and pilot activities of the Medical and Dental Council of Nigeria. And to the inductees, you have sojourned through foreign lands, passed through rivers and oceans, and you have actually burnt the midnight candle, and most importantly, passed through the crucible of the Mdcn assessment exam. Can anyone relate to that? All right. And today, you have been welcomed into what is unarguably the most learned, the most noble, and the most admired of all professions. I welcome you, and I wish you the very best as you pursue a new career. To every other person who, in one way or the other, has made this event a success, we thank you and wish you the very best. God bless. Thank you.
Thank you, thank you, thank you. May we please rise for the second stanza of the national anthem, which serves as our closing prayer. And then, after which we will take the national anthem. We'll recite the second stanza, and then the Civil Defense Band would lead us in the national anthem, the first stanza of the national anthem. So we read the second stanza on the count of two. 1, 2. O God of creation, direct our noble cause, guide our leaders right, help our youth the truth to know, in love and honesty to grow, and live in just and truth. Great lofty heights attain to build a nation where peace and justice reign. Amen. Thank you very much. May we please remain standing as the high table exits the auditorium, after which we may please proceed to the exit gates. Thank you very much for coming, and once again, congratulations to all inductees. Welcome to the medical profession. Please endeavor to complete your oath form and sign them and deliver to the officials that will be going round. Do not go home with your oath form.
Yeah, and I go publish the matter for your sake. You make a man misbehave, And if not fire for fire, indicate. Cause me, I don't know again. Philomena, I say I know me now, you know, say that was a fucking mistake. What's up, Carolina? That's on I go, cause me, I don't do again. What you talk about? Adam. Baby, true love is hard to find. Makes me want to pay the fine. You, Adam. Baby, true love is hard to find. Makes me want to pay the fine. You, Adam. Baby, true love is hard to find. Makes me want to pay the fine. You, Adam. Baby, true love is hard to find. Makes me want to pay the fine. Yeah, and I go fire bazooka for your sake. Fire bazooka. Cause me, I don't come to play. As equal they spin them for your ways. Equal they scatter. I mean, I don't do again. Oh, Philomena, say I know me now, you know, say that was a fucking mistake. What's up, Carolina? That's on I go, the guy, yeah. Cause me, I don't do again. See, baby, I will stick with you like a nanny. Are you getting it? Are you getting it? All your problem, I no say solution, I go, yeah. Are you getting it? Are you getting it? Mama born you well, and you're beautiful too. Girl, I want to hold you. Girl, I love you. Girl, I wanna love you, die. I know you fell in love, but nobody caught you. See, I like this your body, yo. My baby say, call me your dog. Your body, yo. Now you ain't gonna chop on my money, yo. I like this your body, yo. My baby say, call me your dog. Your body, yo. Now you ain't gonna chop on my money, yo. Girl, I want to know you. You go chop belly fool. And now you Scooby-Doo. Cause now your friends now baloo. Malo repetete, malo repetete. Turn the fire the person. We say I don't go love you. Mama born you well, and you're beautiful too. Girl, I want to hold you. Girl, I love you. Girl, I wanna love you, die. I know you fell in love, but nobody caught you. Girl, I like this your body, yo. I baby say, call me your dog. Your body, yo. Now you ain't gonna jump on my money, yo. Girl, I like this your body, yo. My baby say, call me your dog. Your body, yo. Now you ain't gonna jump on my money, yo. So, listen, they be beefing us. Now that they found just to be with us. Hello, I learned what they moyo. Ajayi ori wako de koyo. See the money now. We will know they count this money now. We fully loaded on this bed now. Na. Shake a wallet, go do rosoke. Shake a wallet, go do rosoke. Shake a wallet, go do rosoke. Shake a wallet. Oh, go do rosoke. Shake a wallet, go do rosoke. Shake a wallet, go do rosoke. Shake a wallet, go do rosoke. Okay, see, Bado, baddest guy ever leave it. Headmaster Lamo, Koshe prefect. School Lotiwana, Osua Beefet. Avi Babcock, Kilo de Top Beefet. Mosumola, Shomololi Popla, Onda, Unture, Oya Baby Tola.
kí ní ṣe ọmọ àmọ́ Philip of kọ́là gbogbo wèrè tó máa kó lóde wọn kọ́là JJC kọ́là wọn ilé ọ̀gá adé Eugene àgò jìnnà sílé wa gbàgbé mo ti rán ọmọ rí apá Hausa Fúlàní Ìgbò àti Tápà àwọn ọmọ mi London àwọn ọmọ mi lamẹ́ríkà àwọn Stormont àwọn Somantwerk lórí YouTube I know you love me I love you too story yìí ti fẹ́ máa lọ má ṣe báyìí náà ìgbà wo lóde tó fẹ́ máa lọ má ṣe báyìí náà ọ̀rọ̀ kọ́ ta sí lọlé ojú ẹ lọ́ máa ṣe wà á rán mọ́ta máa sí lọlé wọ́n fọn ẹ̀pá lára ọ̀ndún mi àwọn ṣológbó nìyẹn ọ̀sìn wọn mú mi lọ́jú bá the baby famous but now they found just to be with us àlóhùn àlẹ́nu àdẹ̀mọ́yọ́ Ajayi orí. See the money now. We will know they count this money now. We fully loaded on this bed now. Shake wale, go duro soke. Shake wale, go duro soke. Shake wale, go duro soke. Shake wale. Oh.